Hey, so welcome to Atomic Life. Thank you guys for tuning in. I have Nicholas Weir here with me. We were going to talk about the dangers of massive doses and why it's important to see a doctor when you have health problems. And Nick recently had something interesting happen to him that we'll kind of talk about first, and then we can get into some of the mistakes guys like Dallas McCarver made that led to his untimely death. What's going on, Nick?
Not much. Yourself?
Good, man. Thank you for coming on.
Yeah. I appreciate the invite. Really appreciate it. So yeah, look, recently, I mean, might as well dive into it. I was experiencing some like edema, bilateral edema, so both legs at the same time. And in the past, I mean, I've had this post-show. You know what it's like when you do the post-show binge, and you get that retention, and it's just the body just struggling to regulate fluid after you've been dieting so hard for so long. And also, if you have diuretics in the weeks too, that obviously plays a factor in all of that. But yeah, I mean, I was experiencing it. I'm thinking to myself, it's come out of nowhere. Like I finished my contest prep back in late April, like early May. I was already, I think, at the point that it surfaced about 12 weeks into my off season. And I mean, before I started experiencing it, like I had no swelling whatsoever. And what triggered it was obviously coming over, or what I thought triggered it was coming over to Thailand from Australia. And it's very common to get edema post-flight, especially if it's a long flight, especially if you do what I did, which was take my week's worth of anabolics before I left. Mega dose GH because I didn't want to throw out some piles before I left. And so I was just like waterlogged from all of that, and then high conversion rate to estradiol from taking a bolus dose instead of doing my usual daily microdoses. And yeah, it was just a bit of I suppose, a perfect storm for edema. And yeah, I got over to Thailand, and then I thought, oh, it'll settle down in a couple of days. I'll just elevate my feet, that sort of thing. And didn't really go away. I kept kind of watching it, and I was getting more and more concerned because it had been going on for a while. And it got to the point that it had been hanging around for about 2 months, which is kind of like early this week, which I said, all right, something's really up. And so I thought to myself, everything in my blood work was perfectly fine. Like literally the only thing that was elevated really was C-reactive protein. And I thought to myself, well, my partner was sick at the time I got the blood work, so maybe I would just have a high C-reactive protein from that, and also overreaching in the gym. But yeah, then it slipped my mind that I actually got an ingrown hair just before I left Australia. And it started to get infected on the flight over because I was sweating so much sitting down for like several hours straight. And then it just got worse and worse. And I thought, oh, because I've had ingrown hairs before, I didn't really think much of it. I didn't think anything serious. And I thought, oh, it'll be all right. I'll just like wash it, like scrub it, clean it, that sort of thing. And it'll sort itself out. But it just got worse and worse. And yeah, I saw a doctor today. I went to the hospital, and it turns out it was medical folliculitis, potential cellulitis as well. And that's what most likely was elevated C-reactive protein, and also most likely the sole cause or the main cause of the edema, at least the reason why it's been hanging around. And so, yeah, I mean, it just goes to show it's something that might seem trivial and minuscule can actually be quite serious. It never crossed my mind that an ingrown hair can be that severe. And then, I spoke to actually another person today, a friend of mine, and he said he removed somebody when he was in high school who had an ingrown hair in his glute, and he left it that long that it just bore a hole, and it went straight to the bone, apparently, an infection, and he couldn't play professional sport for about a year straight after he got it surgically removed. And yeah, so it's serious. Like, I mean, I'm on antibiotics now. There's a potential for minor surgery next week just to get a part of the skin removed, just because it's obviously quite infected. But there's a probability that I'll only require the antibiotics. So I'm doing everything I can using antifungal creams, redressing of the area twice a day, and I'm going to try like minimize or limit or completely avoid training this next week, just to allow the body to recover and focus on that, not have any other allosteric load on it, I suppose. And then yeah, just hopefully come good, bounce back, and not have to get surgery, because I mean, I'm sure you'd agree with me, cosmetically it wouldn't look too good on the bodybuilding stage, have a bit of skin removed.
Yeah. So you made me aware of this. We did that call on Saturday with Paul, and you were talking, right? And Todd was trying to figure this out as well. What kind of threw me for a loop is I was leaning toward estrogen, right? Because on your labs, your estrogen was high. So we were just thinking it might be that. But what I thought was
Yeah.
weird is your blood pressure was normal, and a lot of times that'll go up if estrogen's causing it.
Yeah.
But your heart rate was elevated, right? Your resting heart rate was really high, which
Yeah. Which
that
is
kind
an
of led me to
indicator of
think it was an
infection.
infection. Yeah, because that's kind of our body's
Yeah.
response. So, but again, like how would you're a young, healthy guy, like why would you think that you would have some sort of systemic infection from a hair? But the
Yeah,
kind of,
exactly. Yeah.
you know, and I think that that's kind of the lead into this thing is like you and I were talking about, you know, a lot of the unfortunate deaths. There's a lot of bodybuilders that are dying, and a lot of them aren't seeing doctors, and they're trying to self-medicate stuff, and they're using a lot more gear than they lead on to. And I think, and this was kind of where I was going with my video with Todd, is that the theme in the market right now is all the bodybuilders are really downplaying their usage, right? Either they're not telling the truth, or they're telling you what they use now that they're already 280 pounds, and that's not really the whole story, right? Same with cutting cycles.
Yeah.
And that's kind of where I was going with that last video is, you know, he was talking about very low dose of test and just adding a little master on. And I went much more extreme with my example to show kind of what the guys in the Olympia stage are doing, you know, and this is probably where a lot of these health problems come from. Like Dallas McCarver, you know, had a lot of underlying health issues. His organs were all twice the size of normal organs. He had no room left in his chest cavity. He was asthmatic. If you look at his autopsy, one of the mistakes people make is the units that they used when they measured his blood during the toxicology report is it shows his testosterone is 550
nanograms per mil, which
milliliter,
equates to
which is
55,000 nanograms per
so
deciliter.
to translate it for people, that's actually a 55,000 nanograms per deciliter testosterone level. So what probably, I'm not a coroner, but what probably happened is he probably, and it showed, so his blood really just showed for tren and testosterone. The only test for tren in that sort of test is a metabolite test. So there is some possibility that some of the tren crossed over and just falsely elevated the test. But what it looks like is he basically injected it right into a vein by accident, which anyone who's injected, you know, frequently has done this before. That's why you get tren cough, and it probably entered his blood, whatever amount of testosterone he's using, which I'm sure was a lot, entered his blood, and he probably experienced an embolism, right? And he probably died from that. And then when they did the autopsy, he had all that testosterone unmetabolized in his blood. So that's not really what he wasn't using. I mean, I don't think he was using bottles a day. It's most likely he shot, you know, a couple cc's of test, but it like literally went straight into his blood. And so that's kind of
poor administration.
But had he seen, I know he had a history of passing out at shows, right? I think people kept telling him to go see a doctor, and he kind of avoided that. And that's kind of the point, is I think that in the bodybuilding, I mean, you and I both compete. I think, especially at the pro level, guys are very secretive about what they do, right? And that's very cliquey, and they don't really talk openly about what they do. A lot of these guys will downplay their usage, and it's been going on forever. I mean, even in Arnold's days, when these guys talk about their steroid usage, it's not necessarily accurate, right? And it's and then they don't see a doctor. You know, I mean, all these guys, George Peterson had some underlying, you know, issues. Dallas McCarver. I mean, what's your
self-administered polypharmacy, and then it's like there's that much polypharmacy going on that half the time it's impossible to figure out what's going on yourself. You need all of these like medical professionals to run diagnostics and tests, and it's like it's kind of they're really playing a game of Russian roulette, trying to guess like the problem themselves. Like you literally, it's like taking a shot in the dark room with a blindfold on. Like you're not going to have much luck. Maybe if you say like taking one compound, you can really narrow it down. Okay, well, it can only be a handful of possibilities or potential possibilities. But as soon as you have, like, I'm sure you'd agree, like testosterone, then different derivatives of like DHT, 19-mol testosterone, lipolytics, like peptide hormones, and then ancillaries like
insulin,
prophylactic measures. Like, like as soon as you have all of that in the mix, like there's so much going on there. Like there might be potential drug interactions they're unaware of if they don't know much about things. Like if they're taking a blood thinner and then vitamin K, or if they're taking, say, thyroid medication, and then it can be an absolute disaster. Like and that's where I suppose it has value to see a professional, medical professional. Like, sure, like you shouldn't be a hypochondriac and I don't know, go for every single little thing that comes about, but you definitely need to know when to draw the line and seek professional help.
Yeah. And I think, you know, I don't want to speak for you, but I'm sure part of your coaching technique involves that, right? Like I know one of the reasons why people seek me out is because I try to keep people healthy. You know, I don't necessarily require anything of anyone, but my guys that are on things, I kind of want to know where they are, you know, before I adjust anything. And like you said, when you start mixing these things, I mean, it's anybody's guess, right? I mean, equipoise reacts really strangely with estrogen, depending on the person. Masteron can do weird things. Primobolan can do weird things. 19 Nors are a whole nother, like you said. I mean, both Tren and Deca do really odd things with your blood work, you know, and you can't really just guess based on how you feel. Like you don't really know what's going on inside, especially when it comes to organ stuff. I mean, do you get organ scans and stuff, or have you had?
Yeah, so I've had some organ scans done. It's not something that I do very frequently, I'll admit. I probably should do it more frequently than I do, but a lot of the time the way I'll approach it is if all my blood markers are good for certain organs, if I feel good generally, I'll come to the conclusion, okay, I probably don't quite need to look into a scan, but if say there is a couple of markers off for my kidney or my liver, I might be like, okay, it's time to get a liver ultrasound, kidney ultrasound, to rule out potential tumors and things like that might not be as benign as just a bit of an acute elevation due to maybe training too hard for too long or something like that, or using a certain compound for too long. It's definitely something I do see value in. Yeah, and I'm guessing you do too. Like it's something that you do regularly or semi-regularly.
Yeah, I mean, again, not as often as I should. I only have one kidney. I was born with one kidney.
Oh, so wow.
That's something I kind of keep an eye on. It functions as two, so it was actually never picked up in blood work, which is even strange. I didn't find out until I was 39 years old that I had one kidney.
Wow.
So it's actually not that rare. It generally only occurs in men, and men don't get ultrasounds, right? You would see it in a woman nowadays, and you see it in any child that's been born, you know, after the 90s, where they're doing ultrasounds on pregnant women. So it wasn't detected in me. I was born in the 1970s, so they had no idea. But that's the thing, is you just don't know what's going on inside your body. But I agree. I think, you know, especially a guy just starting out, I don't think they need to spend hundreds of dollars on blood work. I think if you do pretty basic stuff, you can get a sense of what, like as a coach, like you and I can look at basic blood work and kind of get a sense of where we should go from there, right? There's certain markers that are elevated just from exercise, like you said, that regular doctors that don't deal with guys like you and I might be freaked out, right? Your liver might be high, your creatinine is a little bit high. But those are normal byproducts of just being physically fit. But like kidney stuff, liver stuff, cardiac stuff, it's pretty scary, right? You have the right amount of drugs in there, and it's kind of a recipe for disaster.
100%, yeah.
You know, yesterday I sent you Andreas Munzer's supposed last cycle. You know,
that was a disaster.
I mean,
it was like a nightmare on paper.
I know. I could always try to pull it up on the screen if people haven't seen it. I mean, again, I don't know how true some of these things are. I mean, he was using an absurd amount of orals, and it's kind of no wonder that he passed away at such a young age. I mean, but I think that's kind of where I'm stuck now, is I feel like pretty much every week now we lose a bodybuilder, right? That guy in Brazil just died a couple of days ago. And then the narrative online is, you know, and I'm just as responsible for it. I think the narrative online is everyone's like, oh, you know, pro cycle is, you know, test and primo. Well, is it test and primo? I don't think running test and primo, you know, at a gram each is going to kill anyone unless you have some really weird polymorphic response to it. I think, you know, something you and I talked about too, about being a fast responder, is the downfall of being a fast responder is you have more receptors. So they found when they studied guys that responded really highly to drugs or really higher to exercise, they didn't necessarily have a higher endogenous amount of hormones. They just had a ton of androgen receptors and IGF receptors. So they just respond.
They were just more efficient. It's kind of like comparing a hybrid motor to like a V8, like, I don't know, like 5.4 liter. Like we just get more out of less. Yeah.
Like you and I, before we were recording, we talked about like first cycles, and, you know, you and I both gained, you know, 20 something pounds on a very minimal amount, whereas not necessarily the norm. It's probably on the higher end of the spectrum. but I think something people need to understand is with those receptors, you have androgen receptors and IGF receptors on your organs as well. So what seems to be happening to the bigger guys that are like the really freakish responders is then their organs grow, right? And then they take, I mean, it's not a lie that there are guys that take 10 grams of gear. I know a few personally. It's not discussed. And if you magnify being, Olympia level genetics with 10 grams of gear, it could be definitely a recipe for a really short life.
Yeah, you could definitely run into some issues quite quickly, shorten your timeline. Yeah, and that's the thing. Like, it's something that really needs to be, I suppose, put out in the limelight more. Like the whole misconception that pros are running just 2 compounds and a total of two grams or something like that. It's just not. It's not real. It's a pipe. It's a pipe dream. Like, it's just yeah.
Like, I don't know about you or what you're, we don't have to get into like very specific personal details, but I know from my experience what happens too when guys start out. It's one of the reasons why when guys that have approached me that want to start doing this kind of stuff, you want to start really low, because the more you use and the longer you use it, the more you need just to maintain your size. A lot of the bigger guys, and I'm not a big guy, but a lot of us need more just to maintain our weight, right? So the cruising dose or TRT dose becomes not a TRT dose anymore. And I don't know if a lot of guys that are starting out really understand that. Like 300 milligrams a test, I would probably hold my weight for about a month, and then I would start to lose size pretty quickly. So it becomes a really dangerous game depending on how long you want to play it and how hard you want to play it.
Yeah, exactly. Yeah, that's the thing. And people, it's almost like the same way people assume, oh, I can just adjust my calories once and stay in a deficit indefinitely, or stay in a surplus indefinitely when they're trying to like gain weight or lose body fat. So no, you need to constantly adjust it as the system advances. Like with anabolics, sure, when you first start, you might be able to just cruise and do a bridging dose of 150 milligrams a week and maintain your lean body mass, but you might only be 180 pounds, you might only be 200 pounds. But when you've added an extra 100 pounds of lean tissue on your frame over the course of 5 to 10 years, you're going to require a lot more than that. I mean, that's the reality I'm sort of realizing now too, that I'm moving up to opens, because I did classic, and I was struggling to stay under my weight cap, similar to you. I think my body just wants to grow. I'm like, you know what? I'm just going to take my foot off the brake and just let my body grow, because I wasn't using a lot either. And I'm not saying that to be one of these people who claims, oh, I'm using less. I genuinely don't use that much, but I do get more out of less. And I've come to the realization that I need to have a slightly higher dose in my bridging phases between courses. So now, instead of doing 200 milligrams a week for a bridge, it might be more like 400 to 500. And that's to maintain and still slowly progress if I want to get above 300 pounds and maintain 300 pounds at a respectable body composition. If I wanted to maintain, like, I could easily, like 200 milligrams a week, probably maintain 240 pounds, like good conditioning. But if I want to be heavier than that, and not be a fat kind of like 260, 270, 300, I need more. And that's reality for most competitors. And it's just a harsh truth. If you're not willing to do that, then you need to probably cross being a professional bodybuilder off the potential list of things you could be.
No, I mean, it's a genetic game, right? Like just like any other sport, right? If you say to someone, like, I'm short, how tall are you?
6 foot 1.
Okay.
Between
say, you must be tall if you can be 300 pounds. So I'm 5'7". Like it's pretty apparent that I'm never playing basketball. Like no one would ever expect me to play basketball. But if you could say to guys in the gym, a lot of guys think it's just they're one cycle away or one magical diet or one training away from being a pro. And they don't understand that those guys are kind of born like that. That's not necessarily, just like most pro athletes are born with the talent. And that's where and I think that's also then these guys use massive doses on top of that. Whereas a lot of guys starting out, you don't need it when you start out, right? Like I think most guys can start with 250 or 300 milligrams and get plenty out of it. If and then on the other side, like a low responder, if you're not growing on 300 or 400 milligrams of test, and then initially, assuming your food is adequate, like you said before, it's almost like maybe rethink the whole idea. Maybe it's not the right road to go down.
Yeah.
Right. Like if you're
If
not
you
going to
care
get,
about your health.
yeah, because it's not, you know, it's not necessarily something that's going to be the healthiest endeavor, right? If it requires massive doses right out of the gate.
Yeah. Well, prices only have to go up eventually. It's like they're never going to go down. So if they're starting, like, I suppose, relatively high, like relatively speaking, then yeah, you're probably going to have to be on astronomical doses if you want to be competing with guys that have cream of the crop genetics that are at the top and using more moderate doses.
Yep.
Yeah.
I mean, yeah. I mean, again, not to use anyone as an example specifically, but if you look at Dorian Yates, right? I mean, how when he was Mr. Olympia, he was massive, and compared to the size he is now. So I believe he's on TRT now, but a regular TRT dose is not enough for him to hold anywhere near that size. So I don't think people quite understand that. Like when you talk about cruising doses, there are lots of pros I know that have to cruise on a gram, you know, and they would probably still lose size at some point. That might last you a couple months before you hit it again.
Yeah.
And then you have esters to take in, you know, listen to Jay Cutler talk about, you know, coming off and stuff. And a lot of these guys don't even realize with the half-life of some of these drugs, they're technically never off drugs. If he was running EQ, 72-day 72-day elimination, if he's only off for 2 months, he's technically never off.
Yeah.
You know,
well, so that's exactly it. And that just comes back to not understanding basic pharmacology and half-lives of drugs. Like it's pretty easy if you do a little bit of reading, you can understand it within 5 minutes, I think. But a lot of them, they don't even acknowledge it as something they don't even consider. And like you said, a lot of bodybuilders will say, "Oh yeah, I'm completely off. I'm natty," but they're not really natty. They're just So maybe they're like their levels like decline and they're not as high, but they've still got the compounds in the system.
Totally.
I always found the whole coming off concept funny. Especially the guys that start their post-cycle therapy 2 weeks after their last injection. Like you've got to let at least 5 half-lives of the drug that you're taking elapse before even considering starting it, because your endogenous production isn't going to even start back up until you like basically your testosterone, to my understanding from when I was at university, your testosterone has to dip below like zero essentially before the body actually kicks back on luteinizing hormone, follicle stimulating hormone. Because it's not like it's not as kind of like binary as people think. Like you can't just be like, the body won't just register, okay, levels are getting lower now, I should start slowly turning things back on. You need to flatline, and then your body is like, oh shit, okay,
turn it back on.
I'm no longer receiving this from an external source.
And that also leads us to another thing. I never understood the coming off thing either. I feel like once you've made that decision to go on, it makes more sense to, you know, establish some sort of TRT dose that you're going to maintain at, because the health goes down the toilet too when you come on and off, right? If you're constantly going below baseline, like you're talking about, I mean, wreaks havoc on your body. So if your goal is like long term, like if you want to be 300 pounds, it would take you much longer to get to 300 pounds if you kept coming off.
Definitely, and it's not just and I'm sure I'd agree, it's not just unhealthy in the sense of, I suppose, not being conducive to your muscle building endeavors and losing muscle, but it's also unhealthy from a metabolic standpoint of like your insulin sensitivity goes to shit, your psychological health, like your mental health goes down the drain. There's so many other, I suppose, co-factors that are affected in that whole situation. Like you don't want to put your body through that. You don't want to, I suppose, willingly put your body through basically, I suppose, like a yo-yo kind of game of just,
I mean, I don't know if you've ever pulled tests entirely for a show or not. When I've done it, you feel absolutely atrocious. Like you don't realize how bad you feel when you have none, right? If you kept other androgens in there and you just remove testosterone, you don't realize how badly you feel. And would feel pretty similar to just coming off right after a big cycle.
Yeah, 100%. Yeah. Well, I pulled it for one show once, but it wasn't even that far out. It was 2 weeks out. But even that big decline that you experience after that first half-life elapses, you feel like absolute trash. Like, yeah.
So what you said before, so maybe people probably don't know this. So every drug based on its ester has a half-life, and to figure out the total peak or the total elimination, you generally multiply by 5, right? So that's where you came up with the EQ thing.
Yeah.
You were taught 5. I usually use 5.5,
Mm.
depending on the drug.
Yeah.
But that's kind of
Yeah.
where we're going.
Yeah.
So,
It varies slightly from,
yeah.
yeah.
So it just to average, every drug is going to metabolize different, and every person metabolizes drugs a little different.
It's a big reason why when you look up half-lives, they'll give you a range of days. It's not like 7 days. It's usually like 7 to 11 days or something like that, because we have fast metabolizers, slow metabolizers. The same way that you say you might metabolize caffeine quicker than your friend, your coworker.
Yeah.
So some people can drink coffee, like they can drink 3 coffees and go to bed. I'm one of those individuals.
Yeah, me too.
Whereas some people drink a coffee and they will be jittery and wide. If they have a triple shot espresso, they're not going to bed for at least 6 to 8 hours. Yeah, 12 hours. Yeah. And so, there's definitely like I suppose, genetic variance when it comes to metabolism of anything, any kind of drug. Yeah.
And you see that too. I don't know if you did any stuff with anesthesia in school, but I mean, that you see that too. That's
one of the jobs. I metabolize anesthesia. I metabolize it really fast. It was bad. I went in for umbilical hernia surgery back in 2020. They gave me a pretty big dose because they're like, okay, you're a big guy. The anesthetist was like, okay, we're going to give you the higher end of the dose. I started waking up before they started the surgery, so they had to give me another shot. Yeah,
with any drug, right? I mean, I've seen it with Botox too. Some athletic people tend to metabolize that really fast, so they'll need injections every month versus other people need it every 6 months. But I mean, that definitely plays a role in how your body uses drugs too. We were talking before about brain, right, and calories and brain and drugs. And do you want to talk about that for a second, because that's a pretty cool concept?
Yeah, definitely. Yeah, I mean, it's something that it probably deserves I suppose, a bit of a deep dive in itself. But yeah, I've always made this observation of when I personally study a lot or do a lot of, I suppose, mentally taxing work in a day, I will feel like I've expended a lot of calories. And in general, I just notice like I've always been able to eat a little bit more than other individuals that may not have been as academically inclined or did as much study. And I've observed it with other people too, friends, colleagues that I know, and the people who are super docile and don't really do a lot, like maybe watch a lot of television, they're just like couch potatoes, like they get pretty heavy pretty easily. And then, I just found I could, I wouldn't necessarily be exercising, but I could just be sitting at a desk doing a lot of study, and I would say be averaging 1,000 calories a day more than these individuals, and I wouldn't be gaining weight. And so I just came to the conclusion that I think even though people downplay the amount of calories that you expend doing mentally taxing work, I think there is something to it. And I think that we probably do expend quite a considerable amount of calories on top of what we otherwise would if we are doing a lot of mentally taxing work.
Yeah, like you and I'm assuming you do the same. Like I'm reading all day long, right? And it's I go hyper pretty quickly, regardless how much food. And I notice the more I study, like you're saying, the more food I need, and it has no negative impact. The brain is a huge consumer of energy, right? For the average person who's not even doing that, they burn like 140 grams, 150 grams of glucose a day just to drive your brain. For someone like you, it could be almost twice that. It'd be kind of cool to see. I don't know if there's any data on that. We could look and do a whole video just on neurological demand.
I think it'd be worthwhile. I think what we'd have to do is probably look into the potential difference in energy expenditure, like with that, like the I suppose the glucose needs of the brain, but then also looking at how needs varies from person to person, because it'll be a case of like breaking it down to its different constituents of like, okay, you probably, if you're studying a lot, doing I suppose a mentally taxing job, like maybe you're some sort of a lab technician or something along the lines of that, and you're doing all of this, I suppose, brain heavy work, and then on top of that, you're also fidgeting, you're moving quite a lot. That's going to play into it too. And so I think, it'll be a combination of those. Like, and I think honestly, you probably agree with me. Like between the increased output, like mental output, and then also the increased output in NEAT, you're probably looking at a difference of say 500 to 700 calories a day. Right? that'd be pretty conservative to say that. Like, I mean, I know NEAT is the biggest contributor to your total daily energy expenditure, so it wouldn't be a long stretch to say that combined with just doing more study could mean the difference between you expending an additional 700 calories a
At
day or
least.
not.
Yeah. Right. And then if
Yeah,
you
at
add
least.
steroids on top of that, growth hormone.
Yeah,
Yeah.
exactly. You're getting quite up there.
It'd be kind of cool if we could do it with medical students, right? Because I think that's one of the most taxing things during residency, when you have to be awake for 24 hours a day and you have to study to pass exams every 2 weeks, right? So they're both physically and mentally exhausted to the extreme, and they're moving. You can't sit still.
Yeah, turning the handle at both ends, essentially.
It'd be kind of interesting to see what their metabolism does during that.
Yeah, it'd just be a matter of finding some resources to reference, and that'd be the hardest bit, I think. But if you can find that, it'll be a real interesting topic to cover.
Yeah, we could definitely explore that. Cool. Do you think that's pretty much it for like all that stuff? You know, I think the moral of the story is if you're going to go down this road, though, I think I don't know how it is in Thailand or Australia. It's hard in the United States to find doctors that understand what we do, that you can trust, right? A lot of people are nervous to talk to their doctors, and doctors tend to not understand even testosterone. So they definitely don't understand steroids. There was a study done or survey done not too long ago on doctors' impressions of various drugs with patients. And most doctors in the United States viewed people that use steroids less favorably than people that use cocaine. So
yeah, there's definitely that shame, whether it's intentional or unintentional. Yeah, there's definitely that shame directed to the bodybuilding community, and it's pretty unfortunate because, I mean, yeah, sure, bodybuilders might be conscious drug users, but they pay their taxes, they hold a steady job, they contribute to society, and then you've got these other people who are heroin addicts, cocaine abusers, like people who are addicted to methamphetamines, and they're cheating the system, like exploiting the system, like on welfare, just being essentially a financial drain on society. And they're seen and met with sympathy and like kindness, and it's a little bit messed up when you really frame it in that kind of a picture. I think everybody should be treated equally. It doesn't necessarily mean that if somebody has a meth addiction, they should be treated less to somebody who uses anabolics by choice. I just think everybody should be treated with the same base level of respect that every human deserves, unless, I suppose, warranting otherwise, unless they do something wrong by you, then that's the instance where you can be selective and say, okay, well, screw you. But if you don't know somebody, it's really sad. But that is a hard thing. It's hard to find a good doctor. It's hard to find. It's definitely the case in Australia. I haven't really gone to seek a regular doctor here in Thailand yet, but in Australia, it's near impossible. It's like finding a needle in a haystack, and I don't think, to my knowledge, I ever found one that didn't ridicule me or criticize me for my personal choices. And at the end of the day, it's a personal decision. I'm not doing anything to harm anybody else. And
you're honestly trying to improve your health.
So I don't harm myself. Yeah, exactly. Yeah, 100%. And I acknowledge and understand that at the high level, like of our sport, the high competitive level, it's not healthy. It doesn't matter how you approach it. It's not going to be healthy, but it's about minimizing the harm that you cause yourself. And so that way, when you do hang up the towel and retire from competing, you haven't done enough damage to kind of warrant, I suppose, spending the next 10 years trying to undo all of that.
Yeah.
Like, you can just kind of get on with your life and move on to a different chapter and look back on it and reminisce and say, oh, wow, that was amazing. Like, I'm glad that I didn't just say what if and never try to pursue that goal that I had. I'm glad you can kind of like go to sleep feeling content with your decision to kind of, follow through with your choices and see what the outcome like ended up being. Yeah.
And and with that, I think if you're struggling finding the right help, though, that's, something that, I can help you with, Nick can help you with. I know Dr. Todd, Paul Barnett. There are coaches out there that can at least be an intermediate, I think, in this process, though. Like if you're unsure, you need someone, to look at blood work and help you make intelligent decisions when it's time to see a doctor, when it might not be. But I think that's the point of this video. I just think that people need to be really careful with this stuff and understand that there's a real risk, and that the risk is taken by these guys that everyone looks up to, whether they admit it or not. It's taken every day.
Definitely, yeah.
Cool, man. Well, thank you for coming on. That's great, Nick.
Thank you.
We'll do this again soon.
Appreciate the, yeah, definitely.